Good afternoon, everyone. On May 29th, 2009, I had a near-death experience that provided me a rare opportunity to rethink what it means to be a doctor and a patient. I'm a cardiologist by training and an avid cyclist. And Memorial Day of 2009 was a beautiful day. I have a cottage down on the east side of Canandaigua Lake, and I was finishing my ride, and there's a turn just at the end of my ride that is a hairpin. And I like to go around that leaning over the way you see motorcyclists do. But I'm always very careful to check to make sure there's no cars or people on the road. And so this day I did the usual, but as I came around the curve, there was a car there, blocking my way. I swerved out to avoid the car, but suddenly found myself flying over the handlebars. I heard a snap when I hit the ground, and I laid there, feeling the sensation and the strength leave my legs and arms. As a doctor, I'd taken care of patients with spinal cord injuries, and I knew that that's what had happened to me. And so that began my Odyssey that had its 3-year anniversary just a few days ago. But I took this as an opportunity to really understand how patients, doctors, and the healthcare system interact. My job is the CEO for the University of Rochester Medical Center. So I have a unique opportunity and position to influence the way patients, families, and health providers interact. And so I've really learned what's important from personal experience, and that is treating patients and their families with dignity and respect, showing compassion and attentiveness, valuing the patient and family as an integral member of the healthcare team, and listening to our patients and families. And so what I'm going to tell you about today is a set of principles that embody these important features called patient and family-centered care, or PFCC. And I'll tell you about the healing power of touch, which is a very powerful way to talk about compassion and caring. So what is the healing power of touch? Well, compassion is that we need to show we care. When I was training, they said that physicians should be dispassionate, that we shouldn't feel emotionally attached to our patients, because if we did, we wouldn't make decisions that were based on the hard science of medicine, that we would be influenced by our emotions. But I think that's dead wrong. I think the reason people go into medicine, nurses, doctors, and any kind of health professional, is because they want to feel emotional. They want to take care of people. And we shouldn't deny them that inborn ability. The best doctors are compassionate. The best nurses are compassionate. But they do this understanding what the possibilities are for a given patient. And joy and hope are two of the most powerful things that we can give our patients and their families to help them heal. So we shouldn't deny those emotional elements. The other piece is attentiveness, which is we need to pay attention to show that we care. You can't go into a patient's room thinking about something else. For that moment while you're there, the most important person in the world is that patient, and increasingly the family that's there with the patient. So two elements are compassion and attentiveness. And so we've incorporated that into patient and family-centered care, which is a set of principles and values that when implemented successfully, improve quality of care, they improve safety and long-term outcome. And there are data now that show that they not only improve satisfaction that patients and families experience while in the hospital, but the providers feel better about what they're doing. So how do we transform a culture from this dispassionate scientific approach to one that is much more attuned to the emotional situation? And so, of course, the first thing we do is we ask our patients and their families, what is it that they would like us to do more of? And the number one thing they say is they want us to respond to their concerns and their complaints, that we address their emotional needs, that we include all the staff in the decisions so that everyone taking care of the patient is on the same page. And they want to make sure that there's time, that people sit down, look them in the face, and touch them. Let them know that they care. Reach out to them not only metaphorically, but physically. And so there are 4 major components that I present every year to the incoming residents and whenever I meet with nurses and other health providers. And those are safety, quality, caring, and courage. Safety is the foundation on which all healthcare must occur, because if a patient feels safe, then they trust their providers. And that trust is essential. If you're going to be able to listen and to believe that what your doctors and nurses are telling you is true, you have to feel safe. And I have stories for each of these, and the green pill is the story for safety. So there's a report from the Institute of Medicine that says there used to be about a 1% error rate in taking medicines. I actually take 40 pills a day. So that means every 2.5 days, I would get 1 wrong pill. So since I couldn't move my arms or anything in the beginning, I learned to tell what the pills were by their taste, their texture, and their size. And my least favorite pill is something called Coleys. It's a little red football-shaped pill, but it's sticky. And I had difficulty swallowing, so it would stick in my throat. And when it dissolves, it has this terrible, terrible acrid taste, just the worst. So I always made sure to swallow it with lots of water. So one day, I had a pill in my mouth that was the exact same size as a Coleys, but it wasn't tacky. So I said to the nurse, "Did they get a new kind of Coleys?" And she said, "I don't think so." And I said, "Really? Why?" She said, "Well, it's a green pill." And I said, "Well, what is it?" And she said, "I don't know." That's an unsafe moment when somebody's giving you something and they don't know what it is. I mean, well, I said, "Oh, well, I'm not taking that one." And I said, "You better find out what it is." It turned out it was vitamin D. The doctors had decided that since I was lying there not moving, my bones would start to melt away, and they would give me vitamin D and calcium. But they never told the nurses, and they never told me. And so that's why communication is so essential. Quality is the foundation on which medical care occurs. I personally benefited enormously from that. We had a program to prevent ventilator-associated pneumonia. I was on a ventilator, and it used to be that 10 or 20% of patients on ventilators got pneumonia. That makes it very difficult to get off the ventilator. But it's been proven over the last 10 years that doing a very small set of 7 different procedures will prevent pneumonia in 99% of the cases. And so I was able to, without having a diaphragm, not get a pneumonia, and in 21 days get off the ventilator. So quality and evidence-based medicine has huge advantages. Caring, the third one, comes in 2 forms. There's the obvious caring that health providers do for their patients, but there's also the caring that health providers have to do for each other and have to respect each other. And I'll tell you a story at the end about caring. And then finally we have courage, which is the hardest part, and that's the emotional needs. For a while, hospitals followed this book called If Disney Ran Your Hospital to try to make us more customer friendly, to greet people and smile at them and show them the way. But I can tell you, hospitals are not a vacation resort. They're not a destination. They're not fun. They're terrible places sometimes, and sometimes we have very difficult things to do. So courage is a key part. Our providers have to have the courage to address difficult emotional needs. When a family or a patient is suffering, and when they know that they may die, that emotional situation, you shouldn't avoid it. You don't have to know the answer. You just have to acknowledge the emotion. You just have to say, I see you're very upset today. Is there anything I can do? And all you need to do is listen. You don't need to solve the problem. You don't need to have an answer. You just need to say, I'm listening. So those are the 4 components of patient family-centered care. And so we've been building a culture at the University of Rochester, as have many, many other medical centers, to create this. And it can be summed up very simply. We used to take care of patients. It was something we did to them. Now, we partner with patients and their families to improve their health. It's a very simple change in phraseology, but it has a profound change in meaning. It brings the family in, because I can tell you, when I finally left the hospital after 121 days, guess who had to take care of me? My family. So they needed to be involved. They needed to know the whole situation, or they couldn't do a good job, or they'd be scared that they wouldn't do a good job. So critical that the family be part of the planning and the decision making. And there are a number of things we do in the hospitals now and in the ambulatory environment that make things better. First, infrastructure. We have new facilities and information technology. The facilities are designed in such a way that there's room for the families to have one place. A futon sofa is a great thing. There's room for the patient, and then there's a separate space for the nurses. And there's enough room, and the rooms are private, that the whole team of providers can come in all together, have a discussion with the patient and family in private, and communicate very effectively. That's totally different than having 2 patients in a small room with the whole team lined up around the bed, looking down at the patient, excluding the family because there's no room. So facilities make a big difference. How we deliver care makes a big difference. But most important are the people who are taking care, who are participating. We need the right kind of people who believe in what they're doing. And so we've encouraged the family to get involved. We've promoted practices that will improve the time to do these interactions. We've broken down silos and made teams of providers. And we've shifted from episodic care, we're taking care of you from Monday to Friday while you're in the hospital for your surgery, to we're taking care of you the entire year to plan your health so that if you do need to come into the hospital, you already have a team of people that you know that can help take care of you. And that continuum of care results in fewer hospital admissions and better care. But as I said, the most important part are the people. And so we've been training our providers to communicate better and to not be afraid to show compassion and caring, and in fact to reach out and offer that. And we need to convey to our patients, using compassion and attentiveness, about the things that matter to them. We have our own plans. You need an x-ray today. You need your blood drawn today. You need to do your physical therapy. Those are all the things we as providers think that the patient needs to do. But we need to take the time and say, what does the patient want? And maybe, for example, they're very concerned about their dog who was at the vet the week before, and they want to know what's wrong with their dog. So we need to help the patient find out, what did the vet say? Or they're worried about another family member who can't afford the parking. So we need to get them parking passes. So we need to find out what matters to our patients, equally to what matters to us. We also need to care for the caregivers. We need to make sure that our employees have a two-way communication. When I'm with one of my therapists or with one of my doctors, I always remember to say to them, I really appreciate that you took the time to do this. Or, you know, it would be better if the nurse knew my blood pressure and heart rate, what it normally was, so that she didn't have to go run and look when there was an abnormal value. So that two-way communication makes for better interactions and also improves the providers. And we make a real effort that all the members of the team are equally important. I can't tell you how great it is when you can eat after they've had you on a feeding tube to have good food. it's a great pleasure to be able to eat. So hospitals should have good food. And just like when you go to a restaurant, the waiters and waitresses tell you about the menu, are excited about the specials of the day. Same thing in the hospital. And I had the same nice lady come up, and she told me about these cinnamon buns that I could have for breakfast. And I can tell you, nothing can make you gain weight faster than a frosted cinnamon bun. And I was pretty skinny, because I can tell you when they feed you through a tube, it doesn't work as well as when they feed you cinnamon buns. So we really made a big effort that everybody, including the food service people, participate in that care. And so we have something called the I Care culture that everybody has on their ID badge that they can see all the time. And on the bottom of that I Care badge, it says, I care always. Because we always have to be mindful that we are taking care of people. And that if we're having a bad day, we need to be mindful of that and not let our situation carry over. And so I Care stands for integrity. We have to be honest about ourselves and what we tell our patients. We have to be compassionate. We have to be accountable. We have jobs to do. We have to do them well. We have to show respect for the patients, the families, and the other providers. And we have to achieve excellence. We have to have quality. So I'm going to end by telling you about the healing power of touch, which I think really epitomizes this new culture. So I had been in the intensive care unit for 8 days. And one evening, when the shift changed, this very nice nurse came in and introduced herself as Megan. And she said, Dr. Berk, it's really a great pleasure to finally be able to take care of you. I've always been a big admirer. So I was feeling pretty good. And she said, and one of the things I really liked about you was your hair. I said, oh, I wonder where this is going. And then she said, gets worse. And then she said, it looks terrible. And I'm thinking, well, I've been in the ICU for 8 days. What do you think? And she said, would you like a shampoo? I looked at her. I had the ventilator, so I couldn't really say anything. So what did I have to lose? So I nodded my head. So next thing I know, she comes out with this bag, like you saw in the old days that women would wear when they were having their hair done in those hair dryers. And using that bag, she could put some water and some soap, and she sudsed up my hair, and then took a hair dryer and blew it dry, and showed me in the mirror how good I looked. And what she didn't know is the only part of my body that could feel was my head. And that was the best sensation that I'd had in my 8 days in the intensive care unit. And it made me feel normal. It made me feel healthy and well. And so that simple act of attentiveness, just that simple touch of massaging my hair and shampooing me, did a world of good for me and made me feel so much better. And so the healing power of touch is real. It's simple. It just requires us to reach down into the fundamental compassion we all share for each other and the respect that we provide each other. And then we'll be able to be better as people and as providers. So I always end with a quote by the poet Maya Angelou. And what she said is, I've learned that people will forget what you said. They'll forget what you did. But people will never forget how you made them feel. Thank you all.